Welcome to the 16th episode of the Reframe podcast. In this episode, we discuss the challenges around the global pandemic of the coronavirus and how to stay safe. Dr. Nisha is a specialist pediatrician at Zahra Hospital Sharjah, where she is highly involved in the Neonatal ICU and running a busy outpatient clinic. We have first-hand experience of her outstanding care for our 3 kids, and we want to share her advice about raising healthy and active children. If you get value out of today's episode, we'd really appreciate a rating on iTunes. You can also subscribe to the podcast on all major platforms. Please help us spread the message by sharing this in your network. Let's get on with the 16th episode of the Reframe podcast with Dr. Nisha Soares. Welcome back, folks. Hope everybody's doing well. Everybody's okay. Hope your family's okay. Precaution, self-isolation, that's the talk of the town these days. And I think that's the best way to save yourself and your family, friends, and your loved ones from this new coronavirus that's been here. We're also working from home. I hope all of you are also working from home and taking all the necessary precautions that are guided by your respective governments. But doctors are the real heroes this time. And thank you, Dr. Nisha, for joining us in our home studio.
My pleasure.
And this is apart from our regular podcast stories. This is also kind of an awareness session where we're going to talk about what the virus is, how serious is it. We've heard a lot of things on social media, but how to keep ourselves safe, how to keep our families and our children safe. So how are you dealing with it as a doctor being on the front line?
Well, like every virus, like every epidemic, we have to keep ourselves secure. We have to know our enemy. So coronavirus is the biggest problem is that it's very contagious. It spreads very fast. Contagion is spread. Infection is when you have it, you may or may not show it. So people are quite confused where you say there are 1,000 infectious cases, but then only you have a few hundreds who are probably hospitalized. So infection is when you have it, contagion is when you spread it, and manifesting the disease or symptomatic is when you're showing symptoms, the sore throat or fever. The thing about the coronavirus is that it attacks a low immunity. That's the key here, a lower immunity. You're older. You have a history of a risk, your chest. Certain viruses affect certain parts of your body, and corona is a respiratory virus. It attacks your respiratory system, especially your lungs. So if you're at risk, a long history of smoking, you have you're on chemotherapy, God forbid, for a cancer. You have other reasons that your immunity may not be at its best. That's when you're at maximum risk for the coronavirus. The corona actually attacks your chest the cells lining your alveoli, so that your chest rapidly fills. It's an inflammatory response, and your chest fills with mucus, in layman's terms, with water. And then it becomes harder and harder to breathe. So that's the worst case scenario. Happily, I'm a pediatrician, and my focus, selfishly so, is my little patients. And happily so, children, especially below the age of 10, seem to be the least involved.
That's a relief.
In fact, I was just reading a case report a couple of days ago about a newborn born to a mother with coronavirus who seemed very healthy. So it doesn't seem like to transferred through the placenta, and if it is, at least in the early days, the infant seemed to have got the antibodies and not the infection. But that's still early days, because this is one of the few case reports we are still, they're just still trickling in everybody's experience.
Right.
That's what everybody's saying, that it's the deaths are happening so rapidly and it's spreading so fast that there's barely any research. People are just nobody's understanding we don't even know if it's mutating or not.
It's still early. It's still very early days, and like any enemy and a dangerous one, you need time. Now, time's not really on our side here, so we have to kind of know standard. We take standard precautions like with any serious virus which has contagion. But yes, that's the whole issue, is that viruses mutate, viruses spread, and viruses give you very little time.
And your patients are the most notorious ones. There was a video on the YouTube of a little girl whose mother was buying sanitizers and she was licking the bar.
Yes, I know. And happily, nature seems to know that the smallest and the most vulnerable one, they are in a way, because they have kind of pristine immunities.
Yeah.
They have, nature has protected them, and that's, like I said, I'm selfishly so, because I'm
sure.
Look after my patient group, but I'm very, very relieved that so far at least, children are a very low risk population.
But generally there's a lot of confusion around how it's spreading and how to be saved from it, kind of thing. Earlier we were all rushing to get masks and all, and then we found out that the mask is not the most effective way to be as a preventive measure, rather than hygiene, personal hygiene. And masks are relevant where actually people such as you, doctors or nurses, on the front line, or somebody who's infected.
Correct, yes.
And then it's changing very rapidly.
Our knowledge grows by the day. Only when you actually we actually learn by mistakes. So we look to other countries to see what went wrong, and then every country tries to kind of redo their measures. So it's a place where we have nothing prior in history has prepared us for this. So
True.
We just learn along the way.
Yeah.
And like all in medicine, it's a learning curve.
Yeah.
Every day in medicine, coronavirus or not, I learn. And we are learning every day.
Countries have suffered a lot.
Yes,
people who took it
absolutely.
lightly. And hats off to the government here. They're doing so much.
Yes,
make
I know.
sure.
And we are very, very, very thankful
Yeah.
for that.
Complete
Thankfully,
streets are being sanitized. Malls are being closed. Everybody's
People
encouraged
were
to
out
work from
partying on the beach the other day. There was like news, why are you people out? Why are you even doing this? It's just crazy. Dr. Nisha, I've always wanted to ask you, why medicine?
Actually, why not?
But
Why not for me was a question. I don't think it was from the time I was little. It was always that there would be something medical.
Oh,
There
okay.
would be something medical, and it's something to do with children.
Oh,
Is
you
it in the
always
family?
knew.
No, actually, my brother is in finance. My mom is a teacher. My dad's an engineer. So in our extended family, yes, there are doctors. But I always liked it. I was always a bit of the nurturer of the family.
Was there
Like
ever
to
a
look
moment that
after.
you said, you remember that this is what I want to be? It's a big field. But was there ever any moment, a doctor that you looked up to, you were in awe of, that usually, it's usually the pediatricians that your kids look up to and like, I want to grow up to be like, I'm sure.
We had a very good family practitioner, but I think from way before that, I just like the idea of medicine. I like to do something with children, and like I always had a plan. If it wasn't pediatrics, it would be child psychology. It would be physiotherapy. It would
wow.
be anything that would involve children.
Why?
Somewhere along the way, because I just liked them. I think we were brought up in a society where we had lots of children around, and I'd always be with the littler ones, and would be organizing things. And a clinic is, I think, an extension
so
of
good
that.
with
So
them.
I enjoy my time in clinic, and it's hardly feels like a job.
I've seen firsthand with you having a discussion with my eldest if he should have augmentin syrup or augmentin capsule. I'm like,
For me, the children, their opinion matters, and
It's
I
incredible.
don't do anything without taking their
take,
opinion.
and I'm talking about a child who's, we usually just tie them up, give them whatever needs to be given, but you always make sure to take into account what they want, how they feel, what they feel, and they're so comfortable with you. So
I like children. I sometimes, I lay down the law, and sometimes I ask their opinion. Not always I can ask their opinions, and
Sometimes you have to be the doctor.
in their better interest, I lay down the law very firmly.
yes, definitely.
Very firmly, but you have to look at. Sometimes I have to play the dictator, unfortunately. But it works out in the end. I think children, in their heart of hearts, they appreciate the fact that
Definitely.
that you're looking out for them. So they may be a bit upset in the beginning.
It's
that
not
you're
also
telling
a very easy profession to be in.
No, not at all. Not at
Well,
all.
it's-
If you love children, then you don't like to see them sometimes go through, or God forbid, bad things happen to children, and it's very hard. It's very hard. In fact, a colleague was just telling me the other day, chatting with her, and she said, she's a medical as well, and she said, I could never take pediatrics because I don't like to see children suffer. I said, well, for the same reason I took pediatrics. I do not like to see somebody suffer, but it's
to help them in any way.
immensely gratifying as such to see somebody getting better, or to see a newborn. Neonatology is a large part of my work. To see a newborn.
We know.
Yes.
First
Yes,
hand.
you all know firsthand. To see somebody born little and with difficulty breathing, and then you get them out of the incubator and you watch them grow. And I think my now, since I'm in the Emirates for so long, my first patients, they were not so small, not that small, but my first prematures now are almost, I'm signing on for university.
Oh, wow.
Yeah, so that's
It's just joy.
Yeah, that's joy, the very first ones.
I remember sending you Ziad's videos, just because you share the same joy in his achievements. That it's incredible. But did you ever waver from the path? Would you recommend your kids to follow medicine?
Oh, I love medicine, and I tell them if that's what they want to do, then please go ahead and do it. There's a lot of work involved, and there's a lot of commitment, but there's a lot of joy. But I give that advice to my children. I tell them to do what they best want to do, because you have to really, excel in what you're doing, and you have to enjoy what you're doing. Two things are very important for any job. You do really well in it, and so whatever they want to do, and I really don't think that medicine is like the be all and end all. I really don't think that it is, all that it seems on the outside. Like when my little one was young, she would put on my shoes and my high heel shoes and my coat and say, okay, now I'm going to hospital, I'm the doctor. And that's what they see from the outside. But it's a lot of work, and lots of broken nights sleep, and lots of work.
I can imagine, because with other professions, you can sort of detach. When you leave your premises of work, you're like, it's a shutdown. But with you, it's not.
No,
I know it's not. With you, it's not. First hand. Because you are there 101%. How do you maintain sanity in this?
Well, it's a long journey, a long lots of learning curves, and I have very good support. I have a very good understanding partner, my husband, who's very good, and I have so he's you cannot take a journey without a wise partner. So that's like a big plus. And in the early parts when I was training, it's like my parents. They are your biggest ones to say that you can do it.
Yeah.
So in every part of your journey, you need wise people journeying with you.
Yeah.
And now I have children, so my older ones are older. They help me with my younger ones. So it's
a team
immensely
effort.
It's a team effort, and you can't do this if in a solitude. You have to do it with a team.
Must have been difficult with little ones when you're.
Oh yes, I know.
Did you ever take a break when you had kids, or was it just
for a couple of months, because
That's
the
not break.
rules? That's the rules say that you come back into work. You can't really, but it's exhausting.
Yeah.
Very, very tiring, because you are with your children almost all night, and then you're in the hospital. And if not children, it's newborns.
Yeah.
So you learn to grab sleep in other parts where you don't, and then you learn to also along the way, you learn to manage work and life.
You love this, but I'm sure there must be times where your family must have felt frustrated with
yes.
you not being able to give them.
Yes,
Yeah,
absolutely. There are sometimes, even my friends, we have a wide circle of friends, and they are extremely understanding. So before they plan an event, they will actually be calling me and asking me, am I on call? Is there somebody there? And then they plan the event, and that's really nice. So, we have very nice friend circle. In my kids and my husband, they know that, this is there. We plan it around that time. So like you have an upside to having the doctor on call with you at home all the time. You have a downside.
I'm sure I have a feeling that your husband's also a partial doctor by now.
Yes. More than partial. Can understand neonatology, knows ventilation. Yes, very well.
Do your kids come with you to the hospital to see you in your sort of
They actually don't come. They come when they were younger, very occasionally, but they would just be basically sitting and coloring.
Yeah.
But that's in a very occasional time. Most often not.
Okay.
Most often not.
Because not also you wouldn't want to expose the kids to other people,
Yes,
infections
exactly. And also
all.
it's like I don't allow children to come with me to rooms and stuff because it's patient confidentiality, and I have never encouraged them to cross with patients, so they don't know anything about the patients. Or vice versa. I don't share information either way. So that they come just to, in case we were going out, they would come to just color in the color room. But they don't actually. They haven't in all these years actually, unless they have been occasionally sick. They've never seen the inside of the Zahra room.
Are you serious?
Yes.
Oh, that's amazing.
That's something, yeah.
Not even seen an Zahra room. They were, when one of them was sick. Yes.
I've seen it too many times.
Yes. So I remember.
I know each room very well. I've always wanted to ask you, how do you build your children's immunity? Because you're there firsthand. You know that low immunity is like the worst thing that can happen to a child. So what do you do as a parent to sort of build up their immunity?
My children will tell you, they have this mantra that they have to have breakfast in the morning.
Oh, okay.
Have to. They catch a very early morning bus because I work and my times are unpredictable. The bus comes really early, but they have to, no matter what day or what schedule they have or what they have to finish, they have to have a breakfast in the morning. And the breakfast has to have an egg.
You're not giving a lot of options here.
It has to have an egg. It can have egg in different forms, and they get really very upset with me. But they've understood over time, because I think that breakfast is a very very undervalued part of a child's health, because they'll have a long break then before they have their lunch, and often they have some extra activities and it goes on. So I don't allow them, and they have cereal, they have to have milk, they have to have some egg, and then they have to have some kind of bread or a paratha or whatever.
Oh, wow.
So they have to have some bits of that. It sometimes varies in quantity, but they have to have that. There is no chocos, there is no chocolate croissant that can happen, and they get very, very upset that it's very, very standard things that
I'm sure you won't even have the chocolate spread. I'm not going to name the name.
No, we have that on occasions when they have pancakes.
We are going to edit this bit out because my kids cannot hear this.
And they get we have an occasion, but that's my part that I'm very, very, and I'm also very, 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 very. I say this often to them, but they have to go out. They have to go out, even when they were in different school systems, and some school systems would give you, they've changed the school system recently, and the previous school had really lots of work and daily exams. They would be probably the only children on the Cornish would go out every single day. I think I've taken them out from the time they're 15 days or maybe 10 days old in the pram, and they would be the ones in the park every day. They'd be the ones on the Corniche every day.
I think it's very important.
Very important to build immunity as well.
Even if
it's
it has to be outside.
Even if it's like an oven outside, it's very
it has
important.
to be. And I always tell parents that even if it's really hot, children adapt really well. You take them later. But I have great faith in sunlight and vitamin D. And now maybe when my older ones are older, they have lots of outdoor activities in school. They may be really tired at the end of the day.
But they are getting their outdoor activity.
So that somewhere or the other they have to be, and I think that's really very, very important. They have to, and even especially in this time, and I talk to all the parents, is don't keep social distance. Don't go close to people you don't know. That's true. But go earlier in the morning, catch the sunlight when it comes out. Don't keep children inside all the time. At this time more than ever, the immunity is so important.
Because of the air conditioning here, and this is all recycled. Even if we open the windows, it's not the same thing.
Yes, absolutely. And that's from the time they're really, really young, and everybody up and down on the Corniche knows that. In fact, I got people who were like-minded. We formed a group. So we have like a WhatsApp group, and just recently lots of people have migrated, but otherwise there were almost like 15 or 20 children, and people would message each other that we're sending our children down, and children would go down to play, and so you kind of have a playtime. I think it's so important.
I'm like a helicopter parent, I'm sure you know, but here, thank God for this place that I can send the kids down for a bit and worry half an hour later.
Yes.
The worry is there, but half an hour I have a break. It's a big thing. It's
I want to connect it to the fact that as the children grow, they get into their teens, they develop their own circle, their own life, their own activities. But then how do you encourage the children to maintain a healthy lifestyle? Because with the social media, with the games and everything, it is becoming increasingly difficult.
I completely agree with that, and I see a lot of that as well. And that's why I think that they have to be conditioned very early. So that's why. And when they go into teens, it's social media, it's a lot of pressure from school work. So I think that's also sometimes you have to kind of lead by example. If you go out, they would probably be more, they would want more to, to go out with you. They see that, you're coming in and you're going out for a walk. So that's, I think, leading by example, because I can't tell the children to go out and then myself sit in front of the television. That won't work. And the second is that it's just a matter of being the nagging mom. Say, okay, go, go. And by the fifth go, they get so tired of hearing you, they say yes. So yes, it's like, you nag and say, okay, go now, go. You really should take a break. I keep telling them, it'll improve your efficiency. Go. And then then they're just like, okay. Just to keep her not hear me again, they'll go. So that's how it happens. Yes.
Yeah, I can imagine. Like,
I also get everybody. So I will ask a friend if their children are coming down, and children are more likely to go down if like-minded people are also coming down. So we, kind of make sure that somebody...
Thank God it's still cool to go down.
Yeah, yes. Thank God it's still cool to go down.
My eldest, one day I was hugging him when he was getting onto the bus, and he's like, Mom, please.
Yeah.
Next time I made sure I gave him a smooch on each side.
But again, with the given circumstances these days, it's not very encouraging to go out.
Yes,
to say the least. Yeah.
No, I think go out, but that there is ample time when things are quite quiet outside. So it's not that you don't go, you stay safe. Yes, you cycle or you go earlier in the morning. It's almost deserted.
It's deserted, yes.
So you choose a time. There is a time, but you have to kind of choose it. And I think that,
otherwise it is going to get very difficult otherwise with the kids. Keep them home for like 14 days. Or 2 weeks, or like for us, like it's been a month keeping them at home. It would have been difficult, and to keeping them away, not interacting with the other families. I think taking them out for a little bit, half an hour, fresh air, a cycle around the corniche, coming back, sweating a little bit is not going to harm anybody.
I don't think so. That's what, you keep your distance, but you stay safe. You're not that you're close within a meter of somebody else. Stay far, but stay healthy also in whatever way you choose.
Right.
To.
That's most important in these times. Okay, your relationship changes, and we've seen it with our children from from an early doctor right on to a mentor and to a guide to the children who are now, like you said, going into professional lives and all. How does that feel, and how do the children react to that?
Oh, I must tell you, I had great joy when one of my first patients, and she was quite much older when I joined, brought her child back.
Oh.
So now I'm seeing my first generation of grandchildren. Yes. So that was quite amazing. Makes you feel a little bit old, but a little bit young as well. So that was very nice. It's very nice because you kind of change from the fact of giving medical advice to many children coming to tell me, oh, I was so inspired, I want to become a doctor because I want to be a doctor like you. And that's really, really nice. That's really nice to hear, because those are the kind of times where you think everything's worth it, when somebody says, I want to be like you. And to seeing, your small patients grown big, and now, they're their children. So you kind of have a small peek as to what grandparents must feel like. And, you're knowing that somebody was so very sick, and they've sent you a medal from their sports day. So they've come out of hospital, and then they've sent you a medal from sports day. So, those kind of, yes, your relationship changes with older children, and you become less telling them what to do and less listening to what they want to do, and then giving them kind of advice, but just, okay, this is what I would do.
But the fact that you are doing what you're doing out of passion, that would resonate a lot when you're advising, older children to say.
Children are very discerning. Yeah. They are very discerning. So they know when you are trying to tell them something that you don't really think it's right, and versus when you're telling them something where you really feel. So I think they will take on board what they think that you're really telling them out of what you feel, versus just the written things in books that you should be saying. So what you really truly think you should say versus what you should be saying. So they're very discerning like that.
Do parents also sometimes make you their resort to explain something or convince their children?
Very often.
A live example here.
Well, yeah. I'm more talking about towards kids who are going into professional education.
Yes, very, very often they would say professional, unprofessional. Sometimes there are difficult situations, and they're not medical, but because you have a connect with the child.
Exactly.
The family asks you to talk to them, and generally eject everybody out of the room and talk to the child themselves. It happens very, very often. And that is, you cannot only do medical things. It's a kind of a holistic thing, isn't it?
Of course, definitely. So do you with the present day and age, there are a lot of other issues that have come up into light. There's autism. Autism has been there, but more in light, and people talk about it more.
Yes.
There's autism, there's dyslexia, and a lot of parents are resistant to the idea of having their kids even if to have them checked. Or do you struggle with that?
Yes, I struggle with both things actually, because now there's a lot of awareness. So sometimes when children are speaking later, you have parents really worried about the fact that they may be autistic, or they may have an ADHD, or and then they come to you with real or a perceived fear. And then you have to separate the two, because sometimes all this, the therapy can be really, really expensive, and then as a concerned person, but not in the circle of the therapy. You have to stand outside and make a choice sometimes for the parent as to whether they should take therapy, or it's okay for them to stay away from therapy and concentrate themselves. And very, very often I tell parents, don't jump, just wait, you work with the child. And it's worked in fact very well, where they have been perceived as being autistic, but the child has been the child has turned out
Or
very
is it
fine.
the other way?
Sometimes yes, and sometimes yes, I have to give parents
Kind of a push towards...
yes, I have to tell them that no, this is autism. And I remember a case of a parent who had come to me with one child, and the other child was sitting away in a pram, probably away, and I was looking at this child but also looking at that child, and I had to take that parent aside and shock the parent. I mean, it was something they didn't even come to see me again for a couple of months, because they thought that was borderline rude. But I was concerned. I was not trying to be intrusive. I was really concerned. And then after that, the mum really understood that and came back. Then it was such a shock, grief for her, but I had to tell her that I was concerned about the other child, and that I really thought that she should get an assessment. And it turned out well in the long run, because she got an early assessment done. The child was a year and a bit only, and the child actually responded well to therapy. And the mum was eventually very grateful that I actually told her that. So yes, sometimes you have to kind of hold on to mums who are really crying, and you're telling them truths that they or telling them things that are very hard, but somebody has to say it. And I with time, you learn that some things have to be said, but say it as best as you can.
I know somebody who's a new doctor, and I asked them, what do you want to specialize in? He says, everything except pediatrician. I don't want to be a pediatrician. And I'm like, why? Get them when you go into a ward and they're like cute babies, and you have to tell the parent something that's not nice. It's not flu, it's not a stomach bug. That's very difficult. And just before that, it's easier to deal with adults than to deal with parents. It's so I'm hats off to you, Dr. Nisha, for...
No, because yes, of course, with all the doctors, they do tremendous job. I cannot think of a responsibility bigger than being a doctor, especially with pediatricians. The moment a child is born into a home, you start depending on a pediatrician, and people are lucky who find good pediatricians such as yourself. And all of that translates into the upbringing of the child, I believe.
But I think there are, pediatricians we are more frontline, more visual. But there are lots of people like the radiologists, the person who's doing the ultrasound for the unborn fetus.
Yes.
There are lots of people actually who are doing a very great
Of course,
job, and
yes.
they're like almost not
Unsung heroes.
and they're unsung there. But
True, no doubt.
everybody, I cannot exist in isolation, and I often depend a lot on my colleagues and my colleagues' input.
The sisters
Luckily, we
and
have
the
a
nurses,
good,
definitely.
My nurses in I got really splendid nurses in my clinic, and you all will vouch for that as
Yes,
well.
definitely.
Who helped me
Definitely.
to liaise with my patients, and who
Even
make
the one who traveled to Australia.
Yes,
Yes.
Luan.
Yeah.
And Luan earlier, before that I had Sister Raji. I've been really, really lucky. And now I have Sister Lally and Mary Ann.
Yeah.
And you work as a team.
I'm sure you would have groomed them when they first joined you.
I think some people just have it in them. They have it in them. And I'm just very, very lucky to have people who have that skill, to be able to
Be smiling all the time.
All the time, yeah.
Literally.
And you've seen clinic. It's so difficult to smile all the time. It's,
Every patient is critical to their, how every parent does. And everybody wants to go in first, but they will, they're so calm, and they'll be smiling. They know the children by name.
Name by name. That's
Exactly.
amazing.
That's amazing.
You know the child by name. I'm different. I'm the doctor. I'm writing out a file, but my nurses know the name. They know what they had come for.
Definitely.
They know what they're. I mean, that's an amazing skill. Either you have it or you don't.
Definitely.
I'm so lucky that my nurses have all had it.
They do, and
I
they're
don't
very
groom anybody.
they're very compassionate. They know, if they'll come and they'll say, oh, this baby has fever. They know how to do it,
Yes, I
and
know.
I feel that makes that that's the difference. When one comes to you, you get the whole package, rather than somebody's like just walking around.
They don't care. They don't bother. And thankfully, I
thank
have
God.
everybody who cares. I wouldn't have it any other way in my clinic.
So what next for you?
The future borders. I think I go one border at a time now. My children are still in the schooling and early late schooling and maybe early university time. So I think that I balance still work-life balance right now, because I think both need equal amount of time.
What is luxury for you?
Luxury is reading a book undisturbed. Without the phone ringing. Without the phone ringing. And I love to read. At any point of time, I have many books I'm reading side by side. I love to read. I read late in the night and early in the morning and at all parts of the day. Luxury is just reading a book. Luxury is, I love the beach. So, walking on the beach. I don't do that very often. But yeah, that would be luxury.
And travel?
I love travel as well. So yes, we do. The children are good travelers. My husband's a good planner, and yes, so that's why we are lucky. We actually travel a fair bit.
So when you're traveling, how do you shut down this part? Like how do you detach yourself from it? Do you?
I sometimes don't completely detach. I would check messages by the end of the day, just because sometimes people are sick, and then the other doctors don't have a hang on what the illness is, and then you don't want mistakes to occur, and you don't want somebody, so you'd probably not be checking it all the time. But I do go back. If you don't have Wi-Fi, well, I can't help that. But when I do check messages, because I find it, like somebody doesn't know a history. You have a long history, and I have patients now with me for a long time. And sometimes people don't know what's happening, and then you have to kind of liaise with, or if you're asking somebody else to have a look, you have to give them some background on what you think.
What age group is your favorite in treating?
Oh, I like all age.
Oh,
Just
come
like,
on. That's a very diplomatic one.
No, it's not. It's not. It's really not diplomatic. It's real. Like I have 17 and 18-year-olds. I have patients when they're really much older. They choose to come to clinic, and they're super fun in their own lingo to deal with.
So they don't want to transfer into.
No, they don't want to transfer to the regular, to the adult, and they're very happy to come and sit on the bed. There is this older, can't say young adult who will sit and tell me about going to the gym and how he wants to use creatine powders, and his mom says no, and can I just tell her that they are not all bad? And it's so much. It's so interesting. It's so interesting. It's so interesting. And then you have the teens and you have the younger ones who tell you that on a single day will draw you a card, one where you're looking really obese and one where you're looking stick thin. So on the same day you have a card where you're in two different. I mean, it's really nice. It's really nice. So I really don't have, and that's honest. I don't have a single age group because every group is so interesting. They're so interesting. They have so much to tell you, and so much that you kind of refine.
Yeah, but one thing that I find very fascinating about you is you can read kids. So when my little one was born and she was in the neonatal, and you met her for the first time, she was a day old, I think. And you said, oh, this one's going to be a fighter. She's going to give you a tough time. And 4 years later, here we are wearing helmets and armor.
Yeah, I know. It's something about the children's eyes, and you can just see it. You can just see the.
I think that's all got to do with the kind of passion that you have for your field. I think that applies to everything. Somebody to excel, it has to come from inside.
I don't know about the excel part, but to enjoy it has to come from inside.
Have you ever thought about teaching?
Oh, I taught for a while in a medical college. I love teaching as well. I think probably I have very strong genes for teaching. My mom's a very good teacher, even if I say so. And
I'm sure she is.
so she's a very good teacher, very good with children as well. Now almost mid-70s and she's still teaching. So I taught in a medical college for a bit and I enjoyed it. Oh, that was fun. to get very bored people to listen to you and to make the lesson interesting. As for a bit, I taught in a medical college for a couple of months, in fact.
So is there something that you want to go at some future time you would want to go back to teaching medicine or just grooming young doctors? And
Yes, possibly grooming younger doctors. It's there's so much of wisdom that you want to give on, and so much you've learned the hard way that you don't want everybody to go through the same cycle to reach the same truth. So yes, grooming the younger doctors, because it's fun to share your experience, and it's fun. Sometimes boring subjects can be quite interesting, if given in the right way.
Who was your mentor during the initial stages of
I had many.
profession?
I had many mentors. I think if I go from back to forward, here in Al-Zahra, and that's one key person who played a very big role for me is Dr. Qazi, Dr. Aslam Qazi, my colleague for many years, and this the most excellent human being and pediatrician I've met. So I think that I can't think of a better mentor to me. I've sat with him in clinic, and just very, very person who'd keep his patients' well-being at the core of his prescriptions, at the core of his treatment, with that their well-being and what they want. So he was like the person I would aspire to be.
Wow.
So that Dr. Qazi for sure. And going backwards, I was taught by very good teachers. So I have had a teacher in the UK. I mean, my senior in the UK, Dr. Philpott, and she was very, very good in teaching me or showing me the ropes on, because it's a different country. And in India, I had a Dr. Barucha, who was excellent clinically. So taught me so much about clinical medicine, and pediatrics in India is so busy. So you kind of sleep every 4 days. It's so busy. But in that you see so many patients. You don't misjudge how much you are going to see, and you really see so much. It helps you so much later.
Yeah, the learning is immense.
Is immense. And if you have a good teacher there, they help you to sort out, to pick up clinical signs. And now when you do rounds, you really thank God for people like that in your journey, that,
They maybe teach you to look at the small things.
The small things, and to pick up small signs, and to look beyond, think beyond what's in front of you. And they just very, 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 very good clinicians. I had very, very good clinical teachers in India. So with that amount of clinical information, and I was in the Wadia Hospital for Children. It's a very, very busy hospital in Bombay. So you have huge amount of clinical, people coming in from all parts of India, and you have very good clinicians. So that's just the best way to learn.
For a young doctor, for them to groom you, to teach you, to
to teach me to think, to teach me to look, skills which nowadays you
beyond the obvious.
Yes, beyond the obvious. Think that they would say, like, or sometimes they think you to think the obvious. So we had professor used to tell us. So he'd say, okay, give me 3 causes of breathlessness, and we'd say, X, Y, Z, and he'd say, oh, Dr. Nisha, when you look at a bird, think it's a sparrow and not a golden eagle. Give me the obvious. Give me the obvious first, and give me the fine print later. So we are taught by really excellent people.
Has being a pediatrician helped you being in your motherhood?
Yes. Actually, my motherhood has helped me with pediatrics. Pediatrics has helped in motherhood because, yes, my like my little one says, I have my PD, my personal doctor, with me at all times. So every itch, every rash, every small earache, throat pain, you just say, oh mom, oh mom, oh mom, and you get. So it makes life easier because you don't have to run around practically.
Yeah.
Fevers, you don't have to really worry too much, or you worry, whichever. And it makes life much easier. You don't have to sit waiting in long lines and things like that. So it's easier. Yes, very much easier. And children definitely make you better
When my
doctors.
brother-in-law was getting married, I said, I don't care who you marry, just marry a pediatrician. We need a pediatrician in the family.
And did he?
No.
Obviously, they're not listening
Obviously,
to you.
nobody listens to me. She married a wonderful person, but from the get-go, they were like, look for a girl for me. I'm like, oh, we're going to go to the hospital and we're going to look for a pediatrician.
No, but Dr. Nisha has been a great one. Thank you so much. But,
Thank you. Thank you for inviting me.
Oh, it was a pleasure.
We don't want to end it so soon like that. There's a lot to talk about. But just to wrap up, what advice would you give to parents to build up immunity for the children, how to take care of children a little better in this situation that we are in right now with the coronavirus going around, and generally as the kids grow, into the...
I think as always, I think you have to eat healthy, and I say that has to be fruits and has to be vegetables.
How to
fresh.
avoid junk food.
Yes. See, you don't, I think practically you can't say no to all junk food. And then it becomes like a matter of secrecy and them having it from somebody else. So you don't say no to it, but you make it a treat. You don't make it a daily thing. And, you keep things readily accessible. So you cut and keep them on the table. So when children are growing and they're hungry, they're going to really access what's easily available. So you make healthy food easily accessible, make it as interesting as possible. Now, it can't be very interesting, but all the time. And I keep telling the children that, food is not always entertainment. Sometimes food is just food.
Yeah.
You can't be eating all the time meals that are going to be super interesting. And from young, they have to be
McDonald's and Burger King
yes,
all
you
the
can't
time.
be McDonald's and Burger King. There cannot be lasagnas all the time. That just sometimes there's no time to make interesting food all the time. Sometimes food is just food, nutrition. Okay, and eating healthy is very important, and also exercise. I think that we overlook a lot. We have a lot of lovely sunshine in the UAE, and I think it's really one of the unused, one of the least used, implements that we have in good health. So I think both, and I think overall also just stay happy and stay healthy, and I think in a little while we'll be all so busy working, we'll forget these calm times. So I think we might as well make use of it, and then don't regret it later when we have to work like crazy. We don't regret the time that we had downtime at home.
Right. Yeah, I think
Cleaner air, cleaner water, less pollution.
Yes,
and rather than being frustrated at so we have this trend on social media, quarantine day 1, day 2, day 3,
I know,
all of those things.
Yes, I know.
Just cherish the time that you have with your family.
Yes, I
connect
really
back
think
again
so.
physically rather than just socially on social media. But thanks a lot. And
thank you so much.
We'll catch you all in the next episode.